All right, the other differentials, and we look at that, and then we have like this, okay? So it should be 7.4. It'd be like 40, but it is like a lot increased. So we see is has got something to do with the lungs, not with the heart. Although it's going to, the course is going to sound like more like a hearty heart problem, but we have focus on lung because of all of that findings. We have been given, and rest, oh, this is like a lot, okay, and then we have to like screen, okay, so it shows like the striate, which is going to have decreased B. We have the muffled sound, and we have the GVT, and we have the alternation of the QRS complex, sometimes increase, sometimes decrease. And if all of these things are present, then it would be cardiac problem like tamponade. But it has got nothing to do with this. This is something odd. So it could be pulmonary problem as well. So let us see X-rays of poor quality, and oh my goodness, what is that? It should be 18 to 24, 55. We don't need to anything else. We know that it is like because the increased BMI, we are hypoventilating, we have less oxygen. So what happens is that? So this is your lungs and you have increased BMI. So you are hypoventilating, you have obstructed sleep apnea. You are going to increase in echo. You have the increased hematocrit. That is what it's shown all over here. What else do we have? We can have the pulmonary hypertension. We can have the right-sided cardiac problem like the cold pulmonary. And we can have like the acidosis. And because of the acidosis, there's the respiratory acidosis. And to compensate that, renal is kidneys are going to maintain bicarb. So we have metabolic alkalosis as well. And what else we have? That's a C notion. So what do we need to do? The first thing is with the positive airway pressure. Then we have to reduce the weight of the patient. Maybe go for the geriatric surgery to reduce the patient. And then we have to, if nothing was, we can give the acetazolamide for these disorders. And yeah. And we have, okay, let's see if we have anything else into the question. JV, okay, we cannot see that, so we cannot say it is like the tamponade. And there's no reason crackled, okay? So it's not cardiac condition. The patient's very obese. We have a little bit of fatigue. Okay, so we're pretty good. We know to select. We know this is because of the viewer hyperventilation, because it was, for example, PE. So we have like a VQ mismatch. So we have the EE gradient. It should be 0 to 14 or something like that. So there's no history of like that. Neuromuscular disorder, we have the GBS, we have ARS, we have like oral certain, all sort of, that is, has got to do something with the CNS, the muscles of the ventilation. No history is given about that. If it was ventricular contraction, all the blood will be pumped into the lungs. We have the crackles, we have the dyspnea, we have like cardiac symptoms, which is not given. AV, bronchospasm. Not really.